The new Hanover County ABC Board is honored to award the Healing Place with $100,000.
I'm Megan Weber-Yusefi, and I'm the Director of Development for the Healing Place of New Hanover County. We are a 200-bed drug and alcohol recovery-focused program, and we also have emergency overnight shelter beds. And the best part of our program is we are completely free to anyone that needs assistance. So we see extraordinary changes with our folks at the Healing Place, and it's so amazing, like from a leadership perspective, to see people come in. They come in on the worst day of their lives. They go to detox. They suffer through withdrawal. It takes 5 to 7 days. In a hospital setting, you see that happen and then the folks leave. You're not really able to track their story. You're not able to get to know them. Under the roof at the Healing Place, we see people come into our detox and then transition to our residential program, where they stay and they live for 6 to 9 months. They are there every day working and fighting the throes of addiction and trying to recover and conquer substance use disorder. And we see them slowly change into someone that you do not recognize, into someone that becomes your friend, your loved one. We are able to learn their stories. We're able to learn how their drug and alcohol addiction has affected their families, how it's affected them as individuals, and we were able to see people blossom into their true selves. So the ABC Board of New Hanover County granted the Healing Place of New Hanover County $100,000 to do a longitudinal study to figure out exactly how our program is affecting the folks that are coming through. So right now we are super reliant on data that we have from the Healing Place of Louisville, which is our parent organization, but we really needed local, homegrown evidence to prove that what we are doing under the roof at the Healing Place in New Hanover County is working. It takes a lot of work. We see about 2,200 people a year that come through our doors, and we want to learn everything about them. We want to learn their age, their race, their background, their employment history, and then we want to follow where they go after that. So we want to learn how long are they remaining sober? Are they able to find a job and keep a job? What kind of jobs will they be finding? There's so much little information that we want to learn about this population, so then we can publish that data and we can understand the efficacy of our program. And it takes a lot of work, it takes time, it takes databases that we'll have to use, EMR, electronic medical records. It's extensive. It'll take us years, and it's expensive. So we couldn't do it on our own. And so, we looked at sources of potential funding, and the ABC Board of New Hanover County stepped right in to help us and understood the importance of this data to really show how effective our program is to this community. Addiction it's a super selfish disease. People are just completely focused on themselves, and they create tornadoes around them in their families, in their lives, in their relationships, and we see those folks work to build those relationships and put them back together. They're able to connect with their children, their family, their parents. They're able to, under our roof, go through the 12 steps and give back to their community. And it's a beautiful process to watch.